Hi everybody, it's Dr. Mary Trumpi. Ready? Okay. Whoa. My knee surgery, all right? And so these are, it's been like 11 days now. And so they give you these little steri strips that keep the incision shut. And so I took it off a little quicker last week, and you could kind of see.
Okay.
All right, so when it comes to like a knee, it's called an arthroscopy because they're kind of going in there, and yeah, the incisions are healed up great, okay? When you have two incisions like this, what they're doing, they went in, my major issues we talked about before is I have, because of the tilt of my kneecap, which is this direction, okay? See how this kneecap's a little more straight? You really want your kneecaps to be here. But if you look at it's, this one goes this direction. I was kind of born this way with my anatomy. So over the years of my training and running with this abnormal tilt of the patella, kneecap, it's worn out all of the cartilage on this area. The rest has a little wear and tear just from what I've done in exercise, but the main issue with the tilt of this patella, it's like an anatomical problem. It's now bone on here. So that, you know, I can do day-to-day activities, walk around, I can train pretty good, but it's the little things like going down a flight of stairs or trying to do a bend. I can't bend down to the floor because that angle like this when you're doing a force, it's really, really sharp pain. So the long-term solution would be a complete knee replacement. So they did a scope and said, a scope is like what they do. They have two incisions here. Sometimes other surgeries have 3 or 4. One is a camera and one is the little probe, okay? And so the camera, and then sometimes if you have other areas, they have an area where it's a water flush in, flush out. So they can take the camera in and out, because if you have them, so in addition to my cartilage wear and tear, the meniscus is all frayed out, the ACL, PCL, they've just been overworn. There's cartilage wear. There was a lot of inflammation inside the joint. And I've had PRP injections multiple times. I did stem cell a couple times. I did an injection of a substance called Synovial, which is really helpful if you don't really have advanced cartilage loss. I suggest everybody try those options before they jump right into any surgical intervention. None of them really helped, but I've been doing this. I've had injections probably 4 or 5 years, okay? And this last year, it just started becoming a constant. So, with a scope like this, camera, guy's got his thing, and let's say you have a meniscus, it should be nice and smooth, okay? Sometimes it gets frayed, and they have a little tiny thing, it's almost like a little chomper thing. It's almost like Pac-Man, you know how Pac-Man eats everything? So, kneecap, I have no cartilage here, no cartilage here, so that's why when I bend, it kills. It's just rubbing. Usually there's cartilage which is smooth. I don't have any, so that's why when you go down a flight of stairs, it just rubs. The meniscus is this guy. It's a C-shaped thing. What happens over time with degeneration, this gets all frayed, okay? Instead of being smooth, it's like the end of a shoestring if it was not, have one of those shoestring things on there. So with the tools, they come in and they just snip, make it more smooth. He also went in and kind of like smoothed out any of the cartilage that was a little more rugged, took away all the meniscus. There is something called synovial fluid. So sometimes when people get their knees drained and they pull it all out and that tube is filled with like clear stuff, that's synovial fluid. The synovial fluid is created by the synovium. Got it? So the synovium, it's like, your knee doesn't really look like this. It's kind of an enclosed thing, okay? The synovium lines the whole inside of the knee and creates the fluid that we need to be lubricated. So it was interesting because I asked him afterwards, I'm like, why does my quad hurt? So I had a big bruise here and my quad was killing me here. I'm like, I'm smart enough to know that that didn't come from his. I'm like, dude, why does my quad hurt so bad? And the surgeon's like, oh, you were bleeding so bad we had to put a tourniquet around it and keep it on for like an hour and 20 minutes. And he says, I don't usually use a tourniquet. He said, it was bleeding so much, it was blocking the camera and the microscope. So there's a flushing mechanism. So he said he has to only use that a couple times a year, but he was like, it was getting really challenging. So I didn't even know that existed, but kind of cool. It just stopped the blood flow, gave me a big old bruise. He did his thing. So that's what arthroscopic surgery would be, okay? Sometimes 2 incisions, sometimes 3 or 4. If they had to go in the back, it might be something different. So they cleaned it all up. It's been almost 2 weeks. I'm doing pretty good. I haven't tried the stairs yet, but I'm walking with 1 crutch. Started my physical therapy with my assistant Wendy, and we're going to talk about that and show you what I'm doing. It's not specific for everybody, but it's kind of interesting to learn about, okay? Knee. Awesome. Cool. So this is Wendy, okay? I've worked with her, shocks Wendy, what?
13, 14 years.
13, 14 years, and she knows the ins and outs of the whole entire business. She's done every position. Super blessed to have this woman.
Thank you.
Sorry. Oh, that's nice. Hey, just to let everybody know, everybody in the office here, we're getting tested weekly for our COVID, so if you see us without our mask, just know we're negative on that. Safe across the board. For now, I'm not wearing my mask. She's been doing a lot of my rehab. She does all Pilates, a lot of anything you need. So what we're showing you right now is something called electric stimulation. Now, electric stimulation is a way to help muscle tightness, spasms. It brings blood flow to the area. It will not build muscle, okay? So everybody knows about the Bruce Lee. He used to put the electrodes on his stomach and zap him, and that's how he got abs, but that's not really how it happens. This is different than, for example, that newbie machine that my buddy Brad Rowe's been using. His machine would work with muscle building and rehab, but just to let you know, these are 2 separate machines. I highly support Brad with the newbie. We don't have that here, but this is what we're doing here.
Shall I place them underneath your...
Wendy knows specifically, but for me, I have a lot of the damage was here and the swelling is still here. So I've put one right here. I always like to put one where the pain is because it helps the pain, okay? It sends a signal to your brain that says, send pain fighting stuff here. So these 2 are good. So in the back of my knee, oh my God. So there's like, this is a good one. In the back of the knee, when you have a lot of degeneration and meniscal problems, your body can create something, maybe in the hole, the knee hole. Thanks. Your body can create something called a Baker's cyst, and it lives in the back of your knee. And it's not really a structure that you can drain because it's just a weird thing. Your body makes it almost like, hey, you're too degenerated, we got to give you some cushioning. So on my knee, I had a Baker's cyst for years that it had actually ruptured, and the fluid that's inside the Baker's cyst, I don't know if it's the right term, but it's kind of acidic, so it can cause a lot of sharp pain. So for years I had pain that came from the back of my knee and went down here from the Baker's cyst. So this, we did this E-stim a few times on the back of the leg, seemed to help quite a bit. So cool. So this is just an example of one of the therapies that we do on most injuries, okay? And now I'll let Wendy do her thing.
All right, so we're gonna start. Let me know when you first feel anything.
Okay.
Should be the front of me.
Thanks. Nothing yet.
Going super
Okay.
slow.
Feeling something?
Okay, so let me know when to stop. You want to take as much as you can, but not up to where it's painful or uncomfortable.
Okay. A little bit. Feeling it? Okay.
Let me know when to stop.
Okay. That feels so good.
Cool. So the feeling will subside. In about 5, we'll come and check to see if you want more.
Perfect.
Awesome.
So this is just a part of the treatments that we can use for any injury, okay? Electric stimulation. Some people, they'll call it electric stem. So people will think, oh, I want that E-stem, like S-T-E-M, but it's actually stim for stimulation. So it's not E-stim, stem. Oh, look at that. That's why. I'm my girl. Whoa. That's good, Wendy. So I have atrophy on this leg already, and the legs haven't been training that much, so that's not fun for me. But even in 2 weeks, it just, you can even see where it's divoted in here. So that, oh, my special pad. Ready? Watch my sit-up. Ugh. Hell yeah. So watch when we put it on a muscle, okay? It's pretty cool. It won't build a muscle, but it can send signals to the brain to get the muscle. Maybe go, yeah, that's a good one. Hey, fire it. And it's pretty cool post-surgical, like how quickly you can recover if you do what's right, okay? Because sometimes, that's why even like little tiny muscular contractions can help with rehab. And so depending on any surgery that you've had, especially when we're talking about the knee, movement is key. Okay.
We're gonna go here first.
Perfect. Woo!
Other ones?
Maybe. Okay, that's good.
Okay. Too much or good?
That's good.
Okay.
Okay,
Too much?
stop. It's pretty neat
You
because
can see it contracting.
yeah, because this is an example of our bodies are electrical units. Okay, woo, baby, woo, woo. So everything in our body is electrical. Okay, so what this is actually doing, it's running a current. It's almost like it's going in this pad, going out that pad. One's like a positive, one's a negative, and every muscle is an electrical unit. So that's why it's interesting to see that that's what's happening. It's making the muscle contract. It's sending an impulse going here. To be the only thing that we can actually make the muscle move on its own. This will not help with atrophy. There are some different machines that have a specific setting for that. But it can stimulate the brain to be like, okay, muscle, remember how you need to work? This is how you need to work. So these are great. Some people get these little home units. They're like 50, 60, 70 bucks. They are really great, but they are only meant to block the pain. That's why these machines here that cost like a couple grand, they have different settings that actually work more with the impulses and different frequencies. I don't know all the things. They help with the inflammation. Whoa.
Shall I bring him down?
So that's electric stimulation. It's helping. It feels great, especially this is my main area of pain. That feels awesome. This feels nice just to keep the muscles fluttering. And it's not really painful. If you turned it up high, it would just be buzzing a lot. So that's one of the things we offer for all kinds of injuries. Like if you woke up with a crick in your neck, we'd have you come right in and do stim on it, because it kind of, what it also does, if let's say you have a super tight muscle spasm, so every muscle should have a perfect length. Sometimes it's too tight or too loose. If it's gone into spasm, it doesn't mean, spasm has a couple words. Like this muscle would be spasming, but sometimes it can go into a spasm where it's almost just locked up. You know, sometimes when you hurt your neck and it just feels tight, that's your muscle gone into like a tight spasm in a generic term. So this is going to help it flutter, 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 flutter. It's almost making it exercise. At some point, it's like, I can't flutter anymore. I'm fatigued out. It'll help it relax. So minor injuries good, major injuries good, post-surgical, all of them are great for electric stim. If you haven't seen the Try Guys video where we did the Try Guys Try Labor Pains, they're like, where'd you find the labor simulation machine? I'm like, it's the electric stim machine, right? So somehow we figured out that when we put it on the guys, we put it on their abdominal region, the low back, it caused the contractions that, you know, somewhat mimic labor pains. You know, I think it's far from it, but that's the same machine, and that was kind of fun. Pain, 0 to 10. 0 standing. Let's see how far I can squat down. Oh no, immediate. Right about there, I have to stop. So pretty good. It feels a little unstable. This is localized cryotherapy, okay? We use this on specific programs, okay? Localized cryotherapy uses a cold, nitrogen-cooled stream of air to bring... It said emergency stop, so we stop. That tells me that maybe something is disconnected in the back. Unfortunately, it's probably out of nitrogen because they need to come fill up this big old tank. But unfortunately, this expensive machine does not let us know when it's going to run out of air. So everything's connected well. Emergency stop means probably no nitrogen. So therefore, I can't show you localized cryotherapy, but... Wow. Oh, that's big.
Really? It's not important about aerodynamics or something?
What I'm going to do today is I'm telling you what we can offer as far as physical therapy and rehab. I just had knee surgery, so one of the things that is pretty cool, we have a new system that we can actually go through, choose our specific exercises for whatever is ailing the patient. For example, it's pretty neat because we can create your own exercise program, your rehab program, and often there's people who aren't wanting to come in now because of COVID. We can create this. It sends a link right to them. For example, check this out. So,
lie on your back with your elbows supporting your upper body. Place a foam roller underneath your affected knee.
anyway,
Turn your hip.
that's just a brief example. So it's pretty neat. This program, we can assess you if you needed to do it through a Zoom where you're live and not actually in office. We can do that. We create your program, sends it to you. You can have it on your phone or your computer, or you can follow it. So this is just one of the things that we're now offering to help you be able to do your rehab at home. We do it here as well, but it's a nice new additive. If you want to do something at home, we can create it for any body part. We even have some Pilates, stretching, and everything. So just in addition to what we offer here.